Hi, my name's Barb.
Okay, hi Barb. So Barb's been with us for a couple of months now. And Barb, can you tell us a little bit about where you were when you were first coming into the clinic and what you were looking to get improvements with?
Well, when I first came, I was struggling with insomnia, and I had some weight gain that I just was having a hard time losing weight. I had kind of figured out that, or felt that something was wrong with my thyroid because of hot flashes, just all the hormonal symptoms going into menopause at a very young age, at 43, which I felt was very young. Let's see, I was then diagnosed with some osteoporosis, which was a concern for me at my age, and I think that's about it.
Okay. Great. And Barb, so we ran some tests on you. Did you feel like the tests were revealing as far as giving you a lot more information about what was going on for your condition? And
oh, definitely, because when I went to just my MD, they did run a thyroid test 6 years ago, said everything was fine, but I was still having all these symptoms. But when we came here, or when I came here, it's much deeper testing. I appreciated the depth of, the blood work and all the things that I had to do, and it really found then that I had more than what I realized going on with the leaky gut and the gluten sensitivity and the other things, and really needed to make a shift in my diet.
okay, yeah. And so you mentioned some of the dietary support and the nutritional support. Since
Right.
we've implemented that, it's probably been about, I think, about a month.
It's closer to 2 months.
Okay,
now.
closer to
Yeah.
2 months.
Yeah.
And so over that 2 months, what are some of the changes that you've noticed as you've been progressing through care?
Yeah. Well, I've definitely lost about 11 pounds, and I'm sleeping much better at night. I find that I don't have quite as much anxiety at night because I think I was kind of dreading whether or not I was going to sleep or not, especially if I knew what my day was going to be like the next day. So I have been sleeping great, which is huge for me. Feeling a little more like I have a little more energy, not needing that 1 o'clock, 2 o'clock nap in the afternoon. Yeah, overall just feeling a lot better. The hot flashes, still having them, but not as intense as what I was before.
Wonderful.
So that's kind of where I'm at.
So good. Are you excited about the care so far?
I am. I'm definitely recommending it to others that I know that I think it could help, and yeah, I'm just really am happy with it.
Okay. Okay, we're here with Tammy. So Tammy, when you first started our program, what were the main things that you were dealing with? What were your main concerns?
A lot of gas and bloating, extreme fatigue. I knew I had many food intolerances, hair loss, and low sex drive.
Okay. How are these things affecting your daily life?
Well, hourly, I couldn't function without a 2-hour nap in the afternoon. I got really irritable if I wasn't able to eat something, and so I had to make sure I always had food in my bag, and just really affect my energy level having 3 growing teenage boys that I needed to try to stay up with.
Okay. And we did a neurologic exam as well as running quite a bit of lab work on you. How did you feel the examination and the lab tests that we ran helped inform you of your condition and what was going on for you?
Well, it really reinforced what the MD said about my red and white blood cell counts being extremely low. Many things in my blood work shown that I was low with iron and the whole blood work panel. And so basically I felt like my body was failing me. I'm a personal trainer, I'm supposed to be healthy and vibrant, and just didn't feel like I was kind of walking the talk.
Okay. And so now we're about 2 months in your program, and what are the changes you've noticed so far? What are the things that you're seeing change?
Well, it's been amazing. Increased energy. My legs no longer burn as I walk up the stairs. The incredible thing is I don't even feel like I have a gut. Like it's hollow, like it's never talking to me, it's never gurgling, and no more gas, bloating. Even my One thing I did mention, I had mood swings. I find myself even smiling throughout the day for really no apparent reason. I just feel just like weight has lifted off my shoulders. I don't know, I'm feeling, getting towards living a healthy lifestyle.
So I'm Terry Crane.
Hi Terry, okay. And so Terry, can you tell us a little bit about what you were dealing with when you first came in the office, what symptoms and problems you were suffering with?
Well, I'd say the main problem was anxiety and depression, but mainly just an overwhelming, just feeling so overwhelmed with even tiny little things happening in my life. I had a thyroid disorder, was diagnosed with a thyroid disorder, so I knew I had that going on, but I felt like something else was going on too. I was having some stomach pain and had never experienced that before. Was just overall not feeling good. So Susanna, I'd known Susanna for a couple of years and had talked to her a few times about coming here and just never did it, and finally I'm just like, I need to come in. So I decided to come in.
Very good. And so what we did with you is we did a neurologic evaluation, and then we ran a number of lab tests. And so when we ran the lab tests, what did they help give you more understanding as to what was going on with your condition?
Definitely. I was diagnosed with hypothyroidism, but the lab tests showed that I had Hashimoto's, which is an autoimmune disorder, which is, you know, completely different than just having hypothyroidism. So it was scary, but also a relief to know that I knew what I was dealing with. And then when we also discovered I had the 2 celiac genes, then everything started falling into place. It's like I realized why I was having so much anxiety and experiencing depression. It's because of the autoimmune disease.
Great. And so as we've been going through treatments, I think we're a couple months in now.
Mm-hmm.
And what are some of the things that you've noticed have changed for you?
I'm not nearly as anxious. I mean, I still struggle with anxiety from time to time, but it's not that overwhelming, like every day and the little things that overwhelm me. I'm not experiencing that anymore. I'm able to handle stress a little better and not fly off the handle. I was just feeling out of control before I came here. Just little things would set me off, and I feel like my body is calming. It's healing, and I just feel more comfortable with myself and just what's going on with me. So
wonderful. And one of the things that we had talked about too is that you were having problems losing weight. You weren't able to exercise like you had wanted to. Have you noticed changes in that dimension as well?
Definitely. I mean, I'm on the Repair-Vite diet, so trying to heal my colon and small intestines, and I've lost over 10 pounds, dropped 2 dress sizes. I mean, this is the way I looked before I had any kind of problems with hypothyroidism, and so I'm really excited about that. I can run again. I can do a lot of the things that I wasn't able to do in those like 10-12 years where I was struggling with, you know, the hypothyroidism and not getting the answers that I needed. So I'm just feeling so much better all around.
Good. That's so incredibly exciting. And so, you know, as far as our program goes, again, we're only a couple months in, but what would you say if we were going to take it away from you, or if this program never existed?
I'd be tearing my hair out. I'd probably be going, you know, keep going back to my doctor and just, you know, having the same things presented to me. Oh yeah, you've got hypothyroidism, and not getting the answers that I needed. I actually, when I went to my doctor, I mean, we thought maybe I had some kind of ovary problem with my ovaries or something, and I mean, it all checked out normal. So I'm just so excited that I got to come here and really find out what I'm dealing with.